now is cystic echinococcus. The causative agent is Echinococcus granulosus. The definitive host. What do you mean by definitive host?
I don't know, sir.
Yeah, definitely a host is said definitive host. In this you see the dog is a definitive host, but the humans are an accidental host. So definitive host is said definitely a host is a definitive host because where the parasite sexual reproduction takes place and it matures into an adult form. So a host, that's why is the definition of a definitive host. If the sexual reproduction does not take place and what adult form is not formed, then it is not a definitive host. It's an intermediate host. Got it?
Yes, sir.
Okay. In definitive host, there is a definitive host of Echinococcus granulosus is a dog and other canine animals who feeds on infected herbivorous mammals. The morphology of Echinococcus granulosus is it has three forms. There's adult form, which is found in the dog's intestine. Larval form, that is the hydatid cyst. So the hydatid cyst contains the larva and the protoscolices. Pathogenic larva is the pathogenic form. There's the hydatid cyst, the pathogenic form. It forms cystic lesions in the liver or the other viscera. There's the other visceral organs. Eggs morphologically similar to Taenia eggs. That is the bile-stained eggs, and it has consists of the embryo consists of 6 hooklets. This is the adult larva stage larva image. It has got suckers, then it has got scolex, then it has got neck, imposture progress. Just I am just going through it simply, but you remember it is like a tapeworm thing. It has got suckers and scolex which adheres to the and with the help of this the adult larva adheres to the dog's intestine. And the right side is the cyst, the single hydatid cyst. This is how the egg of the Echinococcus granulosus looks like. It's bile stained. It has got 6 hooklets, and it is found in stool sample. So the hooklets looks like this on the right side. You can see the black and white image. The hooklets, the 6 hooklets, but it's similar. This egg similarly looks like a Taenia egg, so you can't differentiate. You can't tell that it's a Taenia egg or a Echinococcus granulosus egg. Then there's the life cycle. Life cycle is very important. That's what I told you. The host is the definitive host. There's the dogs and the other canines like wolves or the fox or the other canines, the cat or something. That's the definitive host. Intermediate host is the sheep and other herbivores. Remember, man acts as an accidental intermediate host. It's called accidental intermediate host because the man is not at all actually in the life cycle of a Echinococcus granulosus, but man can get infected by eating the viscera of the infected sheep, or if you imagine that sheep's feces is like the food is stained with the sheep feces and the or the dog's feces, and you consume the food and you'll get the disease. So man is an accidental intermediate host, and it's called dead end host because the larva form the end stage is the larva form or the hydatid cyst. It doesn't get matured into adult form to reproduce the babies. So the infective form is the egg are the infective forms. Egg transforms to larva, that is the hydatid cyst, that penetrates the GIT and migrates to various organs to the blood supply. Mode of transmission, man and other intermediate hosts acquire infection by the ingestion of food contaminated with dog's feces containing Echinococcus granulosus eggs. That's what I said. The mode of transmission is by eating food which is contaminated with dog's feces, which contains the Echinococcus granulosus egg. So you got the life cycle, right?
Yes, sir.
So in this, the man is the accidental host. Remember that they might ask you in the question in Echinococcus granulosus, man a definitive host or the intermediate host or the accidental host. Remember, man is always Echinococcus granulosus is the accidental host. This is the diagrammatic representation of the life cycle of the Echinococcus granulosus. See the canines, they have the adult and the small intestine. They are adult produces eggs which are laid in the feces. The feces eggs they get infects the for the food which we eat, and the plants the infected plants are eaten by the sheep, and the sheep in the sheep there is oncosphere hatches. Then it forms the hydatid cyst in various organs, and this hydatid cyst then what in the dog it actually forms cyst and it forms into adult worm. But in sheep it is a dead end. It forms into hydatid cyst only. In humans also it forms hydatid cyst only. And this dog, how it gets infected is it eats, or the canine gets infected is by eating the infected herbivorous animals or the organs of the herbivorous animals. When this dog eats, the dog gets infected. So the development in a dog, I'll tell you. The dog acquires by consumption of the contaminated viscera of the intermediate host. It contains mature hydatid cyst. There's the intermediate host contains the mature hydatid cyst. Hydatid cyst larva transfers to adult worm in dog's intestine. On maturation, the adult worm produces eggs, which is passed in the feces. So this is how the Echinococcus granulosus develops in the dog. So you see there is a adult worm formation is there, adult worm sexual reproduction is there and forms the eggs. So our dog is called the definitive host. Then development in man or sheep, as in duodenum embryo, in duodenum of the human beings or sheep, it does not develop into adult worm. Rather, the cyst penetrate the embryo, and not the cyst, the embryo penetrates the intestinal wall. It enters the portal circulation and is carried to the liver mainly, or the second organ which gets where it's carried out to is the lungs, or rarely any other organ other than the liver or the lungs. Majority of the embryo destroyed by the host immune response, but few escape the destruction. And the few escaped embryo develops into fluid-filled bladder-like cyst called as a hydatid cyst. Hydatid cyst then undergoes maturation within the organ. This stage is infective to dog and both and other definitive host. So imagine the sheep is killed at that time, and the organ or the sheep is attacked by an animal, canine animal. The canine animal eats the viscera or the organs of other organs of the sheep, and this organ contains the hydatid cyst, and this hydatid cyst enters the canine, and the sexual reproduction happens there in the canine. But in humans, it is the embryo which penetrates the intestine, then it forms hydatid cyst in the liver. Man is the dead end host. Remember that. In man, there's no sexual reproduction, so it is the dead end host. So you got till now, right?
Yes, sir.
Okay. Actually, Echinococcus granulosus is commonly known to us. So even in sleep, you get up, you should tell about Echinococcus granulosus. Next is clinical
Sir,
features.
in canine, only hydatid cyst is found, right?
No. In canine, I told no definitive host means there should be sexual reproduction. So in sexual reproduction, in order sexual reproduction to happen, there should be adult form.
I mean in sheep, sorry.
Yeah, sheep. Sheeps are herbivorous animals like a man only. So in sheeps, right, there's only hydatid cyst. Nothing more than that. Sheep also is a dead end host.
Okay.
Got it? You understood?
Yes, sir.
Okay. Anything else you have doubt about it? About the life cycle?
No, sir.
No, right. Okay, fine. The next is clinical features. Infection occurs in childhood, but gets manifested into adult life. So the patient, the infection, the child will get infected, but he'll manifest the disease only in the adulthood when he becomes big. The site, most common site is the liver, leading to hepatomegaly in 60 to 70% of the cases, or it will be most other common sites are lungs. Symptoms are mainly first due to pressure effect of the enlarging cyst. There will be palpable abdominal mass in the right upper quadrant. Hepatomegaly will be there. There will be abdominal tenderness, and due to obstruction of the blood vessels in the liver as a portal vein and everything, it causes portal hypertension and cirrhosis, and it might cause ascites also, because it might cause the cirrhosis of liver. The next effect is the next symptom is obstruction. Then because of the infestation of the cyst, it may cause secondary bacterial infection as a pyogenic abscess in the liver. Then one more common symptom is the anaphylactic reaction. You know what do you mean by anaphylactic reaction?
Yeah, allergic.
Allergy. So what's the issue? What's the problem with this Echinococcus granulosus? There's cyst, hydatid cyst, right? The cyst might rupture by itself. And on rupturing, no, there will be fluids in the cyst. Cyst actually is a told cyst because it contains fluid, watery fluid or any type of fluid which we don't know. So this fluid, once it ruptures, the sac ruptures and the fluid enters into the circulation. And this hydratic fluid, no, it is very allergic to the human body. So it will cause severe allergic reaction. The patient might die. So cyst leakage or rupture may be associated with severe allergic reaction. So the four common symptoms are: it may be due to pressure effect of the enlarging cyst, like abdominal mass, hepatomegaly, abdominal tenderness, spondylolisthesis, ascites. It may be due to obstruction of the gallbladder, causing hepatitis and all those things. Then it might be secondary, get infected by secondary bacterial infection, causing pyogenic abscess. Then fourth one is the anaphylactic reaction. So this is the hydatid cyst found in the liver, cross-cut section of the liver. So the arrow pointing is the hydatid cyst. Then this is the diagrammatic representation of a cross section of a cyst. You see in cyst, right? The cyst has got three walls. I'll come into a second image which tells about the proper wall layers. But inside you see there is a small round structures that is containing small larva. That is the protoscolysis. On the right side, you can see from down the fourth word is protoscolysis. Here the larva forms. It has then on the second word from the down to right. So right side, second word from below as a daughter cyst. It is called daughter cyst because like the outer cyst is there are small daughter. All the three layers of the outer cyst is the daughter cyst is processing. So it's called the daughter cyst. And below you can see it's written hydatid sand. It's called hydatid sand because all these protoscolysis start moving freely within the fluid of the main cyst. So it is like small sand particles type. So it's called hydatid sand. This is a second image. See that so you see I told right all the three layers of the hydatid cyst is seen. There's a pericyst. Is the outermost one. The ectocyst is the second layer, and the endocyst is the third layer. And this small cyst-like thing which is found in the main hydatid cyst is called the brood capsule. And the one which is called the daughter cyst because it has got all the three layers of the main mother cyst. And next is the hydatid sand. They might ask you what is hydatid sand. It is a freely moving protoscolysis found in the hydatid cyst. This is how the hydatid cyst, small daughter cyst and the freely moving cyst found in the liver. This is a CT scan of the hydatid cyst in the liver. Next is the lab diagnosis. In lab diagnosis, what we see is hydatid fluid microscopy. Wet mount preparation is used. To demonstrate the on wet mount preparation, you will see the brood capsule and the protoscolysis, which I showed you before. The next one, histological examination. It demonstrates the cyst wall and the attached brood capsule. That is, it will show this cyst wall, all the three layers of the cyst, and the attached brood capsule. That's on the left side. You can find attached green color, like a feeding connecting tube, like an umbilical cord. That's the attached brood capsule. And next, the lab diagnosis is the antibody detection. In antibody detection, the test we do is ELISA. The next is the DOT immunogold filtration assay as a DIGFA. And next is Western blot. The imaging we do is X-ray, or mainly we do is USG, that shows mainly the water release sign. Then CT scan, then MRI. Then we used to do before that a skin test was Cassoni's test, but now it's not done. Here actually it's a test in which its main principle is type 1 hypersensitivity reaction. It develops following the injection of hydatid fluid antigen. So it is now obsolete because it can cause severe allergic reaction when that's of the patient also. So now it is not done actually because we have got a lot of imaging techniques and antibody detection. But they might ask you what is Cassini test done for? It is done for Echinococcus granulosus infection, and it is example of type 1 hypersensitivity reaction. Hypersensitivity reaction I'll be taking after like the skin and soft tissue infections. I'll be taking him back to immunology. That time I tell you different type of hypersensitivity reaction.
Yes.
Now is the treatment. The treatment here includes one of the treatment is the PAIR protocol. That is the puncture, aspiration, injection, and the reaspiration protocol. It's alternate method instead of surgery. 4 basic steps are followed. Percutaneous puncture of the cyst, then aspiration of 10 to 15 ml of the cyst fluid, After aspiration, infusion of the scolicidal agent like hypertonic saline, cetrimide, and or ethanol is used. So they are called scolicidal agents because it kills the scolices. Then next is reaspiration of the fluid after 5 minutes. So first you will do percutaneous puncture of the cyst, then you aspirate the cyst fluid of 10 to 15 ml. Then you the 10 to 15 ml is replaced with a scolicidal agent like hypertonic saline or cetrimide or ethanol. Then next is reaspiration of the fluid after 5 minutes. There is a pair protocol. And next treatment protocol is surgery. It's a definitive method of treatment. Indications for surgery are cases where pair is contraindicated. There will be secondary bacterial infection, we prefer surgery. And in advanced disease, we prefer surgery. Anti-parasitic agent used is albendazole is a drug of choice. Then other medication we use is percutaneous thermal ablation. It's a non-invasive method. Percutaneous radiofrequency ablation of the germinal layer of the cyst is done. The next, pardon?
What is ablation?
Ablation is actually like from the with the radioactive method, you kill the bacteria or you kill the organism. Like it's like heating up and killing with the radioactive agent. So with the high radio frequency, you ablate the germinal center of the cyst. That's called ablation. It is done in like even thyroid diseases and radio other like cancer diseases also. Malignancies. Next is Echinococcus multilocularis. Is also called alveolar echinococcus, agent of alveolar hydatid disease because it mainly infects the lungs. Here the definitive host is not dog, it is the foxes. Then intermediate host is not sheep, but here it is the rodents which is the intermediate host. And again accidental host is the humans. Mode of infection is ingesting food that is contaminated with fox feces. It causes multilocular cysts in the liver. It doesn't have membrane and brood capsule. Larva spreads and causes liver necrosis. Here malignant is called malignant hydatid disease because it spreads of the larva to other sites like brain. So here the liver and the lungs also get infected, but more commonly it's the lungs and the liver. It doesn't it doesn't have a membrane. That is a brood capsule. I told you, right? The daughter cyst and the next daughter cyst, you find out the small cystic lesion contain the protoscolices. That a brood capsule is not there. Here the scolices are protoscolices are freely moving inside the main cyst fluid. So larva spreads, and this is freely moving protoscolices causes spread of the larva and causes liver necrosis and the lung necrosis, and it causes the disease. And it's called malignant hydatid disease because there is a easy spread of the larva to other sites like brain and other organs. Now the difference between the Echinococcus granulosus and the Echinococcus multilocularis. In Echinococcus granulosus, the larvae has unilocular cyst. Here the larvae has the multilocular cyst. And it is called unilocular cyst because you see that there is no septa separating in the within the cyst. But in Echinococcus multilocularis, no. The larvae has the cyst has multiple septa which are separating within the cyst. So it's called multilocular cyst. Definitive host in the Echinococcus granulosus is the dog, whereas definitive host in multilocularis is the fox. Intermediate host in granulosus is the sheep, herbivores. There is a sheep, cow, and humans, whereas multilocularis is the rodents and the humans. It causes hydatid cyst disease in the granulosus causes hydatid disease, whereas multilocularis causes malignant hydatid cyst disease. So now you understood Echinococcus multilocularis?
Yes.
Okay. So now we'll come to trematodes. So this is the next family. Till now we studied about cestodes. Now it's trematodes. Trematodes will come to fasciola hepatica. So it is commonly called as liver fluke. Definitive host is sheep or humans. Intermediate host is snails. Infective form is metacercasia, and this metacercasia are found on aquatic plants. That's the algae, then other plant and aquatic plants, which is a source of infection. And in Japan, Chinese or people, they have that aquatic plants rolling, so it can cause the facial hepatica is commonly found in those areas. And pathogenesis is due to the adult worm and the migrating larva. So the infective form of facial hepatica is the metacercasia. In fascioliasis, hepatomegaly, biliary obstruction, and jaundice occurs in the infection caused by facial hepatica. Acute fascioliasis is due to the migrating larva. Chronic fascioliasis is due to the adult worm in the bile duct. That is, it can cause cholelithiasis. What do you mean by cholelithiasis?
Gallbladder stones.
Yeah, exactly. So in acute fascioliasis is due to the migrating larva. That is, migrating larva means the larva starts migrating from one area to area under skin or into the organs, and it causes the following diseases. If it causes into the liver, it causes liver obstruction. If it enters the skin, it causes cutaneous larva migrans. Then chronic fascioliasis is due to the adult worm in the bile duct. It causes cholelithiasis. Then this disease called Hall zone. That is, it is caused by eating raw liver. Adult worm enters the posterior pharyngeal wall. So when eating the raw liver, the adult worm enters the posterior pharyngeal wall. It causes obstruction of the airway that leads to the death. So a person eats the raw liver. The raw liver will be having the adult worm, and this adult worm enters the posterior pharyngeal wall, thus causing the obstruction of the airway that leads to death. That is called Hall zone. Next is this is the egg of the Fasciola hepatica. It is a non-bile stained egg. It is operculated egg. What do you mean by operculation is that on the top of the egg, do you see a small opening type thing with a lid type thing? Can you see?
Yeah.
Yeah, that is called operculum. And it is bile stained egg. Sorry, I told by mistake. Non-bile, it is bile stained egg. And here, no, there is a large unsegmented ovum. You see the eggs, no, there is no segmentation. It's a single large ovum. It's a bile stained egg. So facial hepatica is a bile stained egg. It's a operculated egg with a large, unsegmented ovum. And this is found in these eggs are found in stool sample. The next is diagnosis. In microscopy, egg is found in species. That's a stool sample. Or the next level diagnosis we do is serodiagnosis. There is ELISA. Antibodies are positive for the eggs are demonstrated. Antibodies are positive before the eggs are demonstrated in stool sample. So this ELISA test is useful because before even the stool sample is found in the feces, you can elicit the antibodies in the blood. The next is treatment. Treatment is triclabendazole. That's it's the next form of albendazole. It's called triclabendazole. It's a drug of choice. Before this triclabendazole came, it was bithionol, which was the drug of choice. It was oral bithionol which was given, but now it is a secondary drug. Now it is triclabendazole, which is the drug of choice. The next is Fasciolopsis buski. It's a giant intestinal fluke and lives in the duodenum and jejunum. Most common intestinal trematode that causes infection in the humans. The Fasciolopsis buski is the most common intestinal trematode that causes infection in humans. The definitive host is pigs and humans. First intermediate host is snails, and second intermediate host is the freshwater plants. So this Fasciolopsis, they might ask you where does Fasciolopsis buski lives in the intestine. It is the duodenum and the jejunum. Remember that. And it's the most common intestinal trematode that causes infection in humans. The mode of infection is by ingestion of the freshwater plants. It causes fasciolopsiasis due to obstruction and ulceration. And most commonly in Fasciolopsis buski infection we find is vitamin B12 malabsorption. So there will be vitamin B12 deficiency in patients infected with Fasciolopsis buski. That's very important. They might ask you what vitamin deficiency is found in Fasciolopsis buski infection. That is vitamin B12 malabsorption. You know vitamin B12 absorption. It requires a special type of factor which is in the intestine. You know what is that factor called?
Pardon, sir?
What is that factor called? See, in order for vitamin B12 to get absorbed in the intestine,
Intrinsic factor.
exactly, yeah. So when there is obstruction ulceration within the intestine, there won't be absorption of vitamin B12 and it will cause vitamin B12 deficiency. So use a logic that if a question is come like that, just imagine what causes the intestinal infection, especially ulcer Busky, and it causes what vitamin deficiency is there? It is vitamin B12 deficiency. Got it? Understood?
Yeah. Yes.
Yeah. Okay. So you can connect the dots in each and every question. Because there's a reason for each and every. There's a relation between each and every questions and options.
Yeah.
Now we'll
So
come
they
to diagnosis. Pardon?
said, no, just say in vitamin B12 deficiency, they can get anemia also.
Yeah. What type of anemia you'll get?
Megaloblastic.
Megaloblastic anemia. Right. So I'll ask you one more question. Since you came to anemia, right? There's one more anemia which is related to vitamin B12 deficiency, but it is caused due to intrinsic factor deficiency, not directly vitamin B12. It was intrinsic
Pernicious.
factor. Yeah, exactly. So
Pernicious.
you should not get confused between these two. Because a lot of people get confused. So it is intrinsic factor deficiency which causes pernicious anemia.
I just learned that today, so
Good.
fresh.
Yeah, just keep in mind because you should remember it lifelong. During the practice also, a lot of people get confused in that. So now we'll come to diagnosis. Operculated eggs are found in stool sample. Treatment is praziquantel, which is a drug of choice. Nicosamide also is given, but praziquantel is the drug of choice. Now next egg is next protozoa is Clonorchis senesis. It's also called Chinese or Oriental liver fluke. It lives in the biliary passage and pancreatic duct. Remember, Clonorchis senesis lives in the biliary passage and the pancreatic ducts. Definitive host is man, pigs, dog, or cat. The first intermediate host is snails. The second intermediate host is freshwater fish. So, in trematodes, right, it's always the first intermediate host is always a snail. And sometimes it may come aquatic plants, but most of them are snails. Second intermediate host is freshwater. It will plants, but here it is freshwater fish. Infective form is metacercasia. Fluke proliferates in the biliary epithelium of the bile ducts, causing dilatation of the bile ducts. It is associated. This Clonorchis senesis is also called as Oriental liver fluke or Chinese liver fluke. It is associated with bile duct carcinoma. It causes pancreatic carcinoma. It causes cholangitis. It causes cholangiohepatitis. Cholangitis is
Inflammation of the bile duct.
yeah, exactly. So see, the fluke proliferates in the biliary epithelium of the bile duct, causing dilatation of the bile duct. So all these diseases is associated with the bile duct dilatation only. There is the bile duct carcinoma, pancreatic carcinoma because there will be bile duct and the pancreatic duct obstruction, and cholangitis because inflammation of the bile duct, and cholangiohepatitis is inflammation of bile duct and the liver also. So it's all related. Next is lab diagnosis. The lab diagnosis, there is demonstration of the egg in stool sample. Eggs are bile stained. Convex operculum is seen. Small nope. How do you differentiate Clonorchis senesis with Fasciola hepatica? It is or Fasciola busky is the small nope is seen at the posterior end of the egg. This is the egg of Clonorchis senesis. You see, there's a operculum, a convex operculum on the right side. On the left side, you can find a small nope at the end of the base of the egg. So here treatment is same. Praziquantel is the drug of choice. The next is Toxicariasis. Less common zoonotic nematode it is. Two species of Toxicariasis is found. There is Toxocaris canis, that is dog roundworm, and the Toxocaris cati is a cat roundworm. The life cycle of the Toxocaris. The infective form is the embryonated egg. Transmission is on ingestion of the embryonated eggs contaminated in soil. Larvae hatches in the intestine and penetrates the intestinal wall. Is carried via the portal circulation of the liver. May remain in the liver or carried to the other organs like lungs or eye. Since humans are unusual hosts, further development of larva doesn't take place. So here, no, actually in the life cycle of this Toxicology, here if the humans get infected, it's also a dead end. It does not develop into an adult worm, and since the larvae are present in the humans, it starts traveling from one area to the other area. So here you will find the larva migrants. That is, the larva keeps migrating from one area to other area, causing cutaneous larva migrants, or it may cause visceral larva migrants when it is traveling from one visceral organ to other, like lungs, or it travels to the eyes, or it travels to the brain. So here it is more actually the Toxicology most commonly travels to the eyes. So it causes ophthalmology of the eye complications, the ophthalmologic complications.